Okay, good afternoon, welcome. I'm Aisha Kamal from Jumeirah Baccalaureate School.
And I'm Rachel Jacks, also the school nurse from Jumeirah Baccalaureate School, and I also run the ADHD support group here in Dubai as well.
So this afternoon we're going to go through a session showing you how we support our students with ADHD. We will introduce the school context and how it relates to the DSIB indicators. We'll discuss what ADHD is and some statistics around that. How we actually support the students with ADHD in our school. We'll share some of the strategies that we use. We'll talk about the ADHD support groups, share some websites that you can go to and use, and then there'll be an opportunity for you to ask any questions. So brief context around our school. Our school's Jumeirah Baccalaureate School, and it's only 4 years old. We're in Jumeirah 1 and we run from pre-K through to grade 12. We've got 853 students, so we're a relatively small school. 71 different nationalities, and 33% of the students in our school are on the inclusion register, and that could be for EAL or that could be for a learning support need. We run IPC in primary and MYP in secondary and IB diploma in grade 11 and 12. So these are the DSIB quality indicators that relate to our talk, and 5.1 and 5.2 are the two criteria that Rachel and I get assessed on. Little activity. So in front of you, you have a pack with all the notes from the session on it, and you also have a post-it. On that post-it, can you write down the 3 things that come to mind when somebody says ADHD to you? So any 3 words that come to mind when somebody says ADHD. As soon as you've done that, if you don't mind coming and putting your post-it up on the board. You have a bit of movement.
Bit of movement, work down your lunch.
It's all right, you didn't have to write your name on it. Thank you. Thank you very much. Okay, so we've got many different words on here. We've got hyperactive, argumentative, impulsive, inattention, restless, adamant, fidgety, hearing, learning, restless, tantrums, different, poor eye contact, moving all the time, care and support encouraging. The vast majority of those are negative statements, but as things that usually spring to mind and are the first things that spring to mind when somebody says ADHD.
So ADHD, as many of you may know already, actually comes in 3 different types. Let me put this on here. There are 3 different types of ADHD. Often the one we most commonly think of is a hyperactive child, the one that can't sit still, that fidgets, that's running around the room, always seems to be on the go. This is often the one that is easily diagnosed in schools and easily recognised. The predominantly inattentive child is often the one that we miss. These are our daydreamers, the ones that can't focus, don't stay on track. Usually the ones that academically are lacking, the ones that aren't getting the right help and support there. Often we recognise these as being the girls in the group, the daydreamers in the school, in the classes there. The combined type is the combination type, the ones that show tendencies of both that are combined with hyperactivity but also have problems staying on track and staying and paying attention there. In your handout you'll actually see there's a diagnostic criteria for diagnosing ADHD. Here in Dubai, we're part of the Gulf region of the ADHD support group, and we've actually recently been writing our own criteria for diagnosing ADHD. but any of the educational psychologists and psychiatrists that are here in Dubai will use these guidelines. These are the DSM guidelines. These are the ones that are used in America, but there's also the NICE guidelines, the National Institute for Clinical Excellence, and these are the guidelines that any physician should use when diagnosing ADHD. ADHD can't be diagnosed with a 30-minute consultation and a doctor's surgery. The process itself actually takes between 4 to 6 weeks. It will involve a lengthy process of assessing the child in school, assessing the child at home. As the criteria says on the back, ADHD is not something that's seen in one setting. It has to be seen in more than one setting. So they must show these tendencies at home as well as at school. It also says here that it must actually be present before the age of 7, and it must have been lasting for longer than 6 months. So ADHD is often misdiagnosed. A child who's actually gifted and talented can show many of these signs for ADHD. They're just not being stimulated and occupied in the right way. So good, accurate assessment is an amazing tool to have and can actually help and support many children with ADHD. Now here we have a breakdown of the different types of ADHD and how they actually, you see them. Combined type is predominantly the biggest group, hyperactive and inattentive type there as well. Now statistically, they recognise that about 10% of children worldwide actually have ADHD. 4% of adults actually have ADHD, and often when children are diagnosed, we actually find that the parents actually diagnose themselves as well because they recognise lots of the tendencies that we have. When my son was diagnosed 5-6 years ago, my husband and I sat there and recognised all of the things in ourselves as well as in my son, and we can understand that when we were his age, we didn't actually receive the right support that we needed as children, because back in the 1960s and 70s there were very few cases of ADHD. They estimate in the UK in the early 80s that there were only 12 cases of ADHD actually in the UK. And now if you estimate that there's 4% of children worldwide actually have ADHD, it's a huge difference. 46% of students with ADHD are often suspended, while about 11% of students are actually expelled. Now in America, they estimate that 25% of criminals in the US justice system are actually ADHD sufferers. So in the UK recently, guidelines were established to say that any child that's going to be expelled from school must first of all have been assessed by an educational psychologist to rule out that they don't have ADHD, which I think is a great thing to actually have. They recognise that ADHD students often go off into adulthood. They have more tendency to become criminals, to have unplanned pregnancies. They have more higher tendencies to use drugs and to use alcohol and to use substances of abuse because of their addictive personalities that they often have. However, that sounds quite negative, but it's not all about negativity. Some more statistics for you. Here, as I said, they often recognise that ADHD is more tendency in boys than in girls. It often is followed by genetics, so you'll often find if it's an ADHD father, their ADHD son as well. 5.6% of girls will actually have ADHD too. This is just an American statistics there for you, but the increase of child prescriptions for ADHD drugs nearly climbed 50% from 2002 to 2012, and the next slide recognises that as well. 5.2 million children aged between the age of 3 and 17 were actually diagnosed with ADHD. It's a huge amount and it's actually growing, and I believe very much that that's our recognising the symptoms and being able to help and support our children. When I get together with my friends from school, I've often recognised the ADHD symptoms within my friends, but they weren't diagnosed. They recognise that people like Bill Gates, Steve Jobs were probably ADHD children. They've gone on to achieve amazing things, so it's not all doom and gloom. This is just showing you the amount of prescriptions prescribed in the UK since 2000 to 2012. In 2000, there was just about 269,000 prescriptions written for medication to help children with ADHD. And in 2012, it was over 1 million prescriptions had been written for medication to support children with ADHD. So it's an amazing thing. It's grown so much over such a short period of time. As I say, diagnosis is the thing that we've got to make sure we get right. Are they ADHD? Are they gifted and talented? Do they have dyslexia, dysgraphia? Comorbid conditions are something that we have to think increasingly about within ADHD. They recognise that 50% of children or someone with ADHD often has another comorbid condition. So it's not often just ADHD, it could be ADHD with dyslexia, ADHD with dysgraphia, anxiety, depression, obsessive compulsive, PDD, ODD. My son is ADHD with Asperger's. So it's being able to treat all of the conditions all at once and looking at the child as an individual. No two cases of ADHD are the same. ADHD, as I say, isn't all negative. They are beautiful, wonderful, special children. My son is stunning. He's good looking. He's almost 16. He's survived this long. We're currently doing GCSEs at home with him, and it's quite a stressful time. However, I believe we wouldn't have got here and at this moment in time if he hadn't been diagnosed when he was 8 and he hadn't received the right support and help in school. Because now he takes medication, he's doing really well. He gained 3 A stars in sitting his science exams 2 years early. He got his English exam result in January and he got another A star for his English. So academically he's achieving things that we never thought were possible. But I completely believe that that is because of the support that he's received in school, and I count myself and my son very, very lucky for that. So his face should be smiling at you from the middle of here. But they're creative, they're inspiring, they're passionate, they're wonderful people. They recognise that if you were a caveman, you'd want to be ADHD. If you were a caveman without ADHD, you'd have thought about how dangerous was it to go out and kill the tiger. Should you have fallen and hurt yourself, would the tiger kill you? If you had ADHD, your first thought would have been food. You'd have run out and you'd have killed your tiger. You'd have caught it before you'd even thought about how dangerous it would be. So actually having ADHD has some amazing qualities that we can all actually use and benefit from too. So it's not all doom and gloom. So how do we help students with ADHD?
Mentioned, having ADHD is not a choice. It's something that children or adults have, and it's something that they need to learn to live with, and it's something we need to facilitate and support in school. Students struggle with ADHD, and students struggle with things that maybe other students would take for granted. So things like listening and following instructions. 8 out of 10 students in your class could listen to me talking and, saying, right, stand up, get your book, open your book and turn to page 3. An ADHD child would hear some of that, but then they would also hear the bird singing outside the window. They would hear somebody clicking their pen on and off. They would hear the heels of a teacher walking through the corridor. They would be thinking about something they want to do after school. So they've got all of those thoughts and impulses racing through their brain. So listening to the teacher's instruction is one tiny thing of many, many different things whizzing round. But all we see is, I gave that instruction, you haven't done it. You're being disobedient. You're choosing not to listen. You're opting out. You're not following the instructions. So we need to be mindful and we need to be aware of how different their world is for them. A few very, very simple strategies that require absolutely no resources. So things that you can do immediately to support an ADHD child in class. Make eye contact with them before speaking to them. Cue them in by using their name. Say, Ali, can you open your book to page such and such? Instead of just addressing it to the class as a whole. Check that they understand what they have to do. So after you've given the instructions, say, right, Ali, can you tell me what you've got to do now? Can you tell me the first 3 steps? Rather than, if you just say, do you know what you have to do? The chances are the answer you're going to get is yes. Because it's the quickest way to shut a teacher down. If I say yes, Miss won't ask me anything else. Be very clear but very specific with your instructions. Don't use 100 words if you only need to use 10. So keep it brief, keep it specific, otherwise the message gets lost. Give time to think, to plan, to talk, because these are things that help ADHD children achieve. So what works well for us at JBS? One of the key things that works well for us is communication. So as head of inclusion, I need to be speaking to all of the teachers, with all of my team, communicating with Rachel as the head nurse, communicating with parents, with our school counsellor, with everybody to make sure everybody has the right information. And sometimes that doesn't come from me, sometimes that comes from Rachel. Parents will often go to Rachel as a first port of call because she's a safe person. rather than coming to me as head of inclusion, they may opt to go to see Rachel because she has more knowledge, she has more medical information. She can reassure them that actually it's not a bad thing if you let the staff know your child has ADHD. It means we can help and put some strategies in place. Parents are often scared or may think that their student will be thrown out of school if something like that's declared. So communication is key. Teamwork, everyone putting the child at the centre of what we've got to do. Sharing that information and expertise I spoke about. A child-centred approach, differentiation and accommodations. If you turn to the back of your handout, you've got 3 pages that list all the strategies we use at JBS to support students with ADHD. I'm not going to go through the 3 pages because you have them there, but what I will do is highlight a couple of the really key ones. Anticipating and avoiding problems. With an ADHD child, sometimes if you let things escalate or if you let them get to a breaking point, it's very hard to bring that child back, especially if you've got anger, especially if you've got control issues, especially if you've got some of the other comorbid conditions. So sometimes anticipating and avoiding problems is a good way to de-escalate things very quickly. So for example, with one of the children in my class, I let him walk around. So as I'm talking, I don't mind if he's walking around the classroom, but he knows he's not to interfere with anybody else. He can walk around because he's very restless and it helps him listen better. So I know if he's walking around the classroom and I say to him, "What did I just say?" he can tell me. But if he's sitting on the chair in front of me, the chances are he hasn't heard me. So sometimes it's about being a bit flexible with what you're comfortable with as well. Having them have headphones on. Another child that I've had has his headphones on. He doesn't have them plugged into anything, so there's no music coming in, but it helps eliminate a lot of that excess noise and that sensory overload, so that helps him. Another child does have it plugged into his phone and listens to music, but we've got an agreement that that doesn't happen whilst I'm talking. When they're doing their independent tasks, he can do that and that's fine. So managing behaviour at the point of performance, being consistent. So if you say something, you need to have that consistency, the structure, the routine, but always allow them a comeback. So for example, if there's a consequence for something, say, okay, but if you prove to me in the next 5 minutes that you're back on track, you're working sensibly, you're doing everything I've asked you to do, you can earn that back. Because for an ADHD child, if they get to a point where they've lost something, there's no point in carrying on. I'll throw a tantrum, I'll throw my papers in the air, and I'll storm out. I can't come back. There's nothing for me. Whereas if I know, if I pull myself together, if I can focus, if I can do what I need to do for the next 5 minutes, I can earn that back. I've got a chance of coming back to where I was. So that's really important. Limit waiting times. Any time where you've got an ADHD student waiting is an opportunity for something to go wrong. So limit any waiting time. You know, make sure there's an activity already set up. Make sure there's a task on the board. Make sure there's a discussion point. Make sure there's a picture or something to engage their interest as soon as they come into the room. So you eliminate anything happening any earlier. Controlling noise levels, sometimes just a gentle touch. So just a gentle tap on the shoulder to bring somebody back. So you're not always saying somebody's name. Timers and prompts, colour coding works really well for them to help organise their ideas and their thoughts. And tangle toys or stress toys are very, very good as well. But you can use blue tack, paper clips, things like that. So just manipulatives, things to fiddle with, which again helps keep their focus. Right on the very back, you've got an individual behaviour plan. So the students in our school with ADHD each have one of these, which is shared with every teacher. It's just got key information from the assessment, so positives and areas that we need to address, information about communication with the parents, and then a list of very simple strategies. And these are not strategies because there's 10 of them. This is not every teacher must do all 10. This is you as a teacher pick and choose what works for this child when you're teaching them. Because how the child behaves in a music lesson might be different to how they behave in a maths lesson. How they behave with the PE teacher might be different to how they behave with the English teacher. So these are a range of strategies and it's for the teacher to choose and use what works best for them. And again, it's about being flexible because a different thing will work well with the same child on a different day.
Okay, so just a little bit about the support group. The support group's been running here in Dubai about 5 years now. Started it because of a need that I recognised for my son. I was working in a paediatric clinic at the time, and many parents came to me not knowing where to go, where to get help. There's an awful lot of social stigma attached to ADHD, and many parents were so embarrassed they didn't want to know what to do. But I also got lots of desperate parents coming to me wanting to know what to do with their child if they was going to be thrown out of school, schools not knowing how to help and support the child. So it grew from a very small group. We've got probably about 500 to 700 contacts now in my support group for the children's group, and we meet each month during term time. Each month we have a speaker. It could be a doctor, it could be a therapist talking about a new therapy. It could just be a coffee and support group. It's free. Everybody is welcome, whether you're a teacher, an ILSA, a TA, a parent, you have a diagnosis or you don't have a diagnosis. Everybody is welcome, and we always make time during that session for people just to mingle and talk and share their stories. And I believe that's why most people have got their support from, because I think we, as parents, we need to come together. As a parent of a child that's had difficulty since he was 2, it's very isolating. It's very lonely being a parent of a child with ADHD because no one seems to understand. You see all the other parents in the playground, been naughty again, and all the children all recognise that child as being the naughty child, the one that's always in trouble. So life's very negative for the child, but it's also very negative for the parent, and it's very lonely as a parent. So I believe that the support groups really supported a lot of parents and given them the understanding and the knowledge to know that it's not their fault. As a parent of a child with ADHD, you actually have to work twice as hard as maybe a regular parent to try to make your child fit, to try to help them with their education and supporting them. So this is what the support group is there for. We have resources that I share. So if a parent comes to me saying the school suggests I need to get my child assessed, we have people that other people in the group have used who I can recommend, because there are people and professionals here in Dubai that would give you a diagnosis within 30 minutes and a consultation, a doctor's surgery, and put your child on medication. This isn't always the right way. So there are people that have been used within the group, and I can recommend these people to you. So I'm happy if you want to take my card here, I can share that list with you. It's free. I just share it with everybody because I want the information to be shared. We recently set up an adult support group. As I said, a lot of adults recognise themselves and their children when they're actually being diagnosed. So many parents and adults don't want to know about medication. ADHD, as we say, comes in 3 different types, but the prognosis for children as they grow up means that actually a third of those children grow out of their symptoms. A third of them will learn to control those symptoms that they have and recognise, which is what I and my husband have done. I recognise when I'm doing well, when I'm in a situation I can cope with. This morning in the opening ceremony, I couldn't concentrate because there was people clicking their pens, there were people chatting behind me. I was easily distracted by that. So I recognise situations when I'm much more focused and can concentrate better, and ones that I can't. There are the final third of adults that actually need help and support for the rest of their lives. So I have adults that come to my meetings that are on medication. I've got adults that attend a life coach and support groups, and they actually benefit from that, and counselling too. So we've got lots of help and advice that's actually out there. The final slide is just to give you some information on support groups that are actually out there as well. There's many of them online. There's the ADAs, CHAD as well, another organisation. And then say my own details there as well. So please share my details with anybody that you come across that you feel would benefit from coming along to the support group. People that don't know. There's a lot of stigma associated with ADHD. I've met many parents in coffee shops and little alcoves around the corner because they didn't want to be recognised by anybody that they would know. They didn't want their family to know that their child's got ADHD. Trying very much to break down these stereotypes and try to show people that ADHD isn't a bad thing. It's actually wonderful. My son would love to be here telling you all about it today, but we won't let him. Okay. Does anybody have any questions? Yep.
Is there any empirical evidence in terms of the food habits and ADHD? Like food habits can lead to more hyperactivity or something like that?
There's lots of research being done into the cause of ADHD. More importantly, they're saying that the connection between ADHD and the frontal lobe of the brain and the dopamine uptake is probably one of the main causes for it, but we're waiting on that research being sorted. Many children have food allergies and food intolerances, and I believe that that can affect a child with ADHD, but it can affect all children. I know when my son was small, we actually went through the whole process of trying him on removing chocolate. We removed food colourings. We did brainging, we did kinesiology, we did, you name it. I've tried every alternative therapy under the sun. I've taken homeopathic remedies. We've tried everything, and every little bit that we've tried has helped. And so I believe that your diet is a great thing to start off with. I mean, today's diet, as we all know, for many reasons affects our children and affects us as adults too. So I believe that changing your diet is a great way to start, absolutely. But I don't believe that it's necessarily the complete picture for many children. Yeah. Yeah.
How about never listening? Never ever listening. Just never following instructions, always screaming all over the place. What do we do about that?
Well, some of it is actually learnt behaviour, and that's the hardest thing, that many people try to diagnose children too early. So I've had parents that come to me and say, the school wants me to diagnose my 4-year-old. And a lot of it is that we haven't learnt the behaviour. So parenting skills are really important, and making sure that children have routine and have boundaries in place and they learn to behave. If children can't behave, and as they get older, so by the age of about 7, 8, 9, and the school is still saying that there's a problem and it's affecting their learning, then this is when we need to look into it a little bit further and look for an assessment. But a lot of it is learnt behaviour.
Also, what about if they don't like to go to school? They just try to avoid it as much as they can.
Avoiding it's very common in children with ADHD, that they don't want to put themselves in situations that they're not going to succeed in. Can you imagine being told, no, you're wrong, sit still, stop it, sit down, you're wrong, sit down, come on, sit back, pay attention, you can finish this, you've not finished your work, you're not going to get a grade for this. Life's very negative for children with ADHD, and that's quite demoralising for them all as well, I think. Yeah.
Can you repeat the picture before this? Because the grey colour is not clear with the...
Which one would you like?
The one with the sides. The contacted. The one, exactly.
This one?
Yeah.
I think these details are actually here on your handout there as well. They're not too clear, unfortunately. But the presentation will be on the What Works website there as well, I believe, too. Any other questions?
Do these medications have any side effects for the child?
They do, unfortunately. Here in Dubai, there are 2 main medications that is used. There's one called Concerta, which is a methylphenidate, which is a stimulant medication. It lasts for 12 hours, or roughly 12 hours. My son takes it. His side effects that Robert's had is that he has a loss of appetite when he takes it. There are other side effects as well, but the loss of appetite is the main one that most parents will actually talk about. But at the time when my son took it, he was a bit chubby. He's now a lean, handsome machine, and he's fine. But we've actually learned and recognised that he has an enormous bowl. I've had to buy him a bigger bowl for his breakfast in the morning, and he has 5 Weetabix in the morning with drinks, and he munches and snacks throughout the day. And when his medication's worn off in the evening, he then will eat a normal sized meal. He usually has several bowls of cereal and fruit and snacks before he goes to bed. And this is how we've learnt to cope with that. Some children have problems actually going to sleep at night time, depending upon when they take the medication too. So there are other medications that your doctor will actually prescribe to help them sleep. But generally, the side effects, for us, the side effects were less important than the benefits of the medication. It doesn't always work for everybody. The other type of medication that's available here is one called Strattera, and this works in a different way. It takes about 10 to 12 weeks to actually build up in the child's system, and so you're looking for a concentration in the body before you actually have an effect. Some people like this before they like to use Concerta, because Concerta is Ritalin. You may have heard of Ritalin. It's one of the oldest drugs that's been around since the 1960s. It's got more research than probably any other medication on the market, I believe, and is very, very safe. But Ritalin is actually usually short acting, so it usually lasts for about 4 hours, where Concerta lasts for about a 10 to 12 hour range, so it works much, much better.
Do you prefer that ADHD students join the normal classes, or do you put them in a separate class because they have special teaching learning styles or special ways to teach them?
I think it depends on the individual child. My son is, as I say, is very, very clever. Part of the assessment process was looking at his intelligence, and he came out on the 98th centile. He was very clever, but he wasn't achieving what he could do because we didn't understand how to help and support him in class. And so I believe that if you put him into the special education requirements and put him on individual support, he wouldn't have done as well. He needed the support in class with his peers and his friends, and he did well. But I know and recognise that some children do need that one-on-one support. A lot of it is learnt behaviour, and so often we say that the medication is like putting the floorboards into a house. If you put the floorboards in, when you teach these children what's expected and normal behaviour and how to learn, they can actually learn. But you can put all of this information into a child, but they don't often learn it unless you put the foundations in for them to actually learn. So there's a benefit from both approaches.
I look through these sites. Do I have special ways to teach them in math? They have special ways, not they know.
I think, Aisha, you know more about this than
It's more
me.
about varying your strategies than it is anything else. ADHD isn't a learning difficulty, so it doesn't impact on the student's capacity to learn information. It's a difficulty with attention and potentially hyperactivity. So it's about changing your strategies. So maybe if it's I don't know, I'm teaching algebra, for example, and I'm writing it up on the board and I'm showing the children that way, an ADHD child is going to switch off. It needs to be practical for them. It needs to be visual. It needs to be hands-on. It needs to be talking to somebody and explaining it to them. So it's about changing your strategies and changing the ways you're expecting the children to work rather than changing the content of what you're teaching. And in our school, we don't have any ADHD children who are removed. They are all in the mainstream class with everybody else learning what everybody else is learning. They may just be taught in a different way. So the teacher may adapt a different strategy, a different style. A lot of the time teaching ADHD children is also trial and error. What works with one child today may not work with the same child tomorrow, may not work with a different child the next week. So it's about being flexible, being adaptable. There isn't one fixed, correct way to do it. The other thing I'll just draw your attention to, which I forgot to do earlier, is on the strategies sheet, there's a title that says Test and Exam Accommodations. Every child with an ADHD diagnosis has these accommodations in our school. So every child has 25% extra time for every test and every exam. Because for them to sit down and read a task or to read an exam paper will take longer than any other child. They may have alternative assessments depending on their level or ability. They may have a reader or a scribe because it may be difficult for them to get the answers written down quickly. They may lose focus. It might be quicker for them to be able to say the answer to somebody and somebody else to write it down for them. They may have a prompter. So often, they will be in a separate room for a test. They do the same test as everybody else, but it's just somebody to say, Rachel, keep going. And that's it. So no help with the work, but just to keep them on task. They may have a 5-minute break where we stop the exam time, they get to walk around. And then we come back, we start the time again. So it's different things to make it work for them.
Well, do you think such students are to sit together with the other normal students who don't have ADHD?
All of our ADHD students are in the mainstream class with everybody else. It's the best way to share good practice and correct behaviour strategies and correct outcomes that you want the students to have learning from their peers. It's the quickest and easiest way, and it's also...
Ma'am, actually, sometimes it is very difficult for the teachers to devise, to work out different strategies, for one type of students, and whereas they are sitting on the other, normal students we can call them. So don't you think that it's a little bit difficult for the teachers even?
I agree, it is difficult.
How to tackle the problem, while teaching them under the same roof. How to,
That's what teachers do. That's our job. Our job is not easy. A teacher's job is never easy.
Do you think a psychologist is also needed there?
We do have educational psychologist assessments because I can't diagnose ADHD. I can say, I suspect this child may have difficulty with attention. I can say they're finding it really hard to listen in class, you know, they're constantly moving, speak to the parents and say, have you noticed this at home as well? But I'm not qualified to diagnose it. It has to be done by a specialist. Yeah, we would always recommend that to parents.
All these accommodations are we providing for the senior graders also?
We provide those for every student
Because
with ADHD, with an ADHD diagnosis, not a student we suspect. If they have a diagnosis, yeah.
But I need to say, because in CBSE curriculum, sometimes these accommodations may not be possible in 10th grades or grade 10 or higher grades. So how to handle those kind of situations, that becomes really difficult at times.
It's not possible because of the curriculum or the staffing or...
So the curriculum, it's an NID assessment pattern wherein
Yes.
all the students have to appear for the same curriculum. They evaluated on the same basis, provided they have certain accommodations like extra time or
But-
suppose visual impairment, then they can use the magnifying
And
glass.
again, it depends on
things
the
like that.
disability level. It is not
Yeah.
for all. Even if in it has to be more than 60% or 70%.
Oh, for us, if they have a diagnosis of ADHD, then we can provide that accommodation
Even for
within
extra,
MYP.
because, with ADHD, we are having difficulty there only for the grade 8, 7th, 8th also.
That's really sad, isn't
Yeah.
it, though, that we can't
Yes.
actually give these children that little bit of accommodation that they actually need to succeed.
That's where we
And
are
it's-
struggling with CBSE curriculum.
Yeah, that's very sad.
Maybe email somebody in the curriculum.
Excuse me, could we classify them, with SEND students, special education needs students?
They would be
ADHD
classified
students?
under the same register. Yeah, our ADHD students are on our inclusion register, along with the gifted and able students, the EAL students, the students with dyslexia, dysgraphia, cerebral palsy, a whole range.
Any sort of neurosis or like depression?
Any student who needs additional support would be on that register, whatever it's for, whether it's for gifted and able because they're very, very bright and they need to be challenged, whether it's because English is a new language for them, or whether it's because they have a diagnosis. They're all entitled to the same support. Yeah.
Okay. I just have a few things to say, and first I just want to thank you for starting a support group. My son has ADHD. It was very difficult coming to Dubai from the States, having a second grader with ADHD and every teacher assuming he was naughty. He also has OD. So it was very, very difficult. I have 4 children. He's my 3rd child, and he's just as normal as any child in any classroom. He's actually extremely special because he just beats to his own drum.
Yeah.
He thinks outside the box, and I think he's just a gift to anyone who ever meets them. So there's nothing wrong, and I think there's a lot of negativity when we give a label. We assume they're not normal, or that they're different, or that you have to change the way you're doing it. Same way when you're in a classroom, if you have a child that can't see very well, you're going to seat them closer to you. A child with ADHD is someone you're going to chunk material for. Instead of giving it in one big blurb, you're going to sit it down and just go over organizational tips with them. Same thing you would do with a child who might be struggling with reading. It's just finding that key. And the best thing is to have an actual teacher who's willing to put in that time. Because I've had nightmare school years where I would come home every single day crying because a very negative teacher who assumes that he is not sitting down, therefore he's disrespecting me, versus teachers that allow him to sit on the carpet when he needed to sit on the carpet. And he's now 15 years old. We did try medication in 2nd grade. We had the lowest dose of Adderall. It was a nightmare. It wasn't him. He was pale. He was lethargic. I decided personally to take him off of it. And I suffered consequences throughout school for that. But as a family, we sat together and we worked really hard to pull through and set up guidelines. And again, he's 15. He's calmed down a bit, to say. He's learned how to deal with it. But every once in a while, when we have that teacher that assumes that he's being disrespectful or I'm going to put him on the spot in front of everyone, it's total shutdown.
Yeah.
So I think as educators, I'm so happy that you guys are here to even talk about this. Everything you said is stuff that I know, and as I kept nodding, because I was so happy to hear that, but unfortunately a lot of people just look at it as someone being naughty, or he's just disrespectful, and are actually brilliant minds. So if you just put in that extra effort, it's amazing. It's an amazing
I'm
thing.
currently
So I
supporting
really
a
thank you.
child at the moment in a school. The school are insisting on putting him on a behavioural plan, that he's naughty, and the teacher doesn't understand about ADHD. And that's the thing with lots of teachers' education, is that many teachers aren't taught about children with special needs. They're not taught how just doing something so simple can make a big difference to a child. And I know that in my school, when we've had children that have come along, I've told the teacher, this is my role, this is what I do. If you need any help and support, don't hesitate to come. And I remember one teacher saying, oh no, I'm fine, I know all about it. And 2 months later, she actually came to me and came to the clinic and said, Rachel, I'm really struggling, could you just help me? And I went over just some very simple things, and that was great. It made such a difference to that child, and that child was able to succeed. But it was a big thing for her to actually say she didn't know, she'd not been taught about looking after a child with ADHD, because ADHD really is relatively new if we think about it, that the numbers are growing enormously at the moment, and many teachers aren't actually taught how to help these children. And it's just simple techniques that we need to learn that can actually make a huge difference for them.
But as our colleague here said, being positive about the children is key, because they sense if you're frustrated with them, and they sense if you don't care, and that you just see them as an annoyance or a hindrance. So they really need to see that you care, and they need to see that you want them to succeed and that you expect them to succeed the same as everybody else.
Providing LSA's learning support assistance.
How can social worker help students?
Yeah, we do have, we do have special needs assistants in our school.
In the classroom.
Yeah, they go to some of the different classrooms and support different children with different subjects at different times. Yeah, not just the ADHD children. Yeah, sorry.
Ask how can the social worker help students like this cases? School.
The social worker, like a counsellor type role, is this what you mean?
Social worker.
Social work.
Social worker.
Yeah.
I ask can help student these cases student in the school.
I mean, social worker to me is someone that works in the community, that works and supports families in the community. In the school setting, they need to support the family as well, and work with the family and support the family within the school setting, making sure that everybody's taken care of within the family and the student particularly. We have a great school counsellor who actually will work with our students and support the children in school, because there is so much negativity often associated with ADHD for that child. They're easily bullied, they're easily picked on, lack of understanding from peers and also from staff, so it can be very negative. So a counsellor, a school counsellor is a great person to get involved with these students to make sure that they are actually coping as well and getting the right support from a multidisciplinary team. Great.
Lovely. Thank you. Thank you very much.